fragmentation and understand it a bit better. Now, the reason is that we do a lot of tests on sperm DNA fragmentation, and it's probably time to understand what we are looking at. And this was from quite a good paper where it looks at reflections of sperm DNA fragmentation and what we have learned. So, the evaluation of male factor infertility is important. The question is how? How do we effectively measure male factor infertility? In about 50% of cases, some form of male factor infertility is associated with sperm chromatin fragmentation assessment. And this has been recognized as an important tool in implantation failures and miscarriages. Now, if you look at sperm fragmentation, it occurs when a single or double-stranded DNA breaks in the linker region of sperm DNA, bound to protamine, and thus causes more damage. So in simple terms, you're looking at disruption of the DNA in sperm. So if you look at morphology, where does a large part of morphological abnormalities lie? They lie in the head. That's where the DNA is. So I tend to say, well, is there any other way of assessing the DNA? And probably sperm DNA fragmentation is one way. Now, the sperm chromatin structure is considered to be a gold standard, and the most sensitive test seems to be the single cell electrophoresis assay, which is known as also the COMET assay, with two variations which are alkaline and neutral, and that helps you to distinguish between single and double-stranded DNA breaks. Now, if you look at the two most useful tests, they are the chromatin dispersion and the tunnel test. And the researchers found that the tunnel test is less subjective and capable of screening few available spermatozoa in cases of severe oligospermic. So if you tend to look at the sperm DNA fragmentation, depending on which setup you have, you may end up seeing that some of these, somebody with a low sperm count, you may not be able to do the test. Now, in some cases, the tunnel test you can also do with slightly lower sperm counts. The fragmentation appears to have a greater impact on embryo development. And again, we've seen couples who have a high DNA sperm fragmentation have a slow conversion to blastocyst or no conversion to blastocyst. It seems that when you do ICSI, you are covering the impact, or in fact, taking care of the impact of DNA fragmentation. And it may be because that the gametes are not being exposed to reactive oxygen species generated by decaying cells. So you're in fact taking them away from that hostile environment. Now, with ICSI, morphologically normal sperm is injected, and you may still end up seeing the impact of sperm DNA fragmentation even after ICSI if the embryo growth is affected. There are some cases which also are other evidence that there may be recurrent miscarriage or miscarriage with high DNA fragmentation of sperm, but I believe that data is still not very clear. So the important questions remain. What do we do with severe sperm DNA fragmentation? It has been shown that sperm progresses to the male genital tract, and during this phase, the DNA damage tends to increase. Now, the efforts have been aimed at identifying spermatozoon with the highest motility and superior genomic integrity, and it's important not to overlook maternal age. So, you could spend months and months looking at how to improve sperm and forgetting that the woman is getting older. Now, in some cases where you can just not get a good conversion to a blastocyst, and you see high DNA fragmentation, in those cases, trying to do a surgical sperm retrieval may be helpful. And that search continues. That search continues to look at how do we find out the right sperm, how do you find out whether we can choose the right sperm, and trying to improve on male factor infertility. So that's a bit of an update on